Now I'm going to discuss some of the decision-making process that goes on between a patient and her surgeon following diagnosis of breast cancer in terms of what the appropriate surgical approach should be. After being diagnosed with breast cancer, most patients are perhaps somewhat overwhelmed with their diagnosis and understandably may be very concerned about what kind of surgical options will be best for them. We know again that from extensive research data, I just want to say that lumpectomy and usually combining that with radiation has been shown to provide equivalent survival as mastectomy. But I do see many women struggling with the issue of whether they should undergo a mastectomy or whether they should undergo breast conserving surgery. I think some patients believe in their minds as non-physicians that if a little bit of surgery is good for a cancer, then wouldn't it be even better to do something more radical to remove the entire breast? And so my approach in counseling patients who have those concerns is again to get back to what the research data shows, that the survival is the same whether they have a mastectomy or breast conserving surgery or lumpectomy. And I try to address their concerns and worries about what they perceive to be the benefits of one surgery versus another, one approach versus another. Now there are some patients that will be better served by mastectomy, particularly patients that inherit an abnormal gene, for example, that puts them at higher risk of getting other breast cancers, or women with an extensive family history, or women with extensive breast cancer within a breast or multiple breast cancers. But in general, patients often are somewhat overwhelmed, and I think it's very important for the doctor and particularly the surgeon to take them through the risks and the benefits and the sort of the appropriate decision-making process that's right for them. Now, about 90% of all women diagnosed with breast cancer in this country will be good candidates for breast conserving surgery and will not derive any significant medical benefit from more extensive surgery such as a mastectomy. And again, I try to have that discussion with each individual patient based upon her concerns, her fears, and her desires and preferences.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.